at the emergency medical conference. And I'm just always like so in awe of how much work all of you do, and how much heart and soul you put into your work. And one of the things that I always try to remind you and all of us, that this work that you do is sacred. And it's just such an honor to be able to come in and share and talk about how we can better take care of ourselves in different ways. And so with that, I want to just kind of start today with a grounding, and just getting us grounded and centered, and taking a moment to do a little bit of self and community and spiritual care. And so if feel comfortable participating, or if not, you can just listen, and that's fine too. Just taking a moment to kind of regulate our nervous system and get settled and bring some oxygen to our system so we can share some knowledge together. So, just get comfortable in your seat, and close your eyes if you feel comfortable, and taking a deep breath in, remembering that breath is one of our first medicines. It's like one of the first medicines you do when you're born is take a deep breath, and then yell, usually cry. So take a deep breath, and just acknowledging the sacredness of that breath and our connection to one another. Even though we're on a Zoom, we're still connected through this air, through the trees, through the water. I like for you to just imagine the sacred energy coming from the ground, from our Mother Earth, coming up through your feet, through your legs, through your hips, up your back, down your arms. The sacred energy of Mother Earth is about holding us and providing us and grounding us, protecting us like a good mother does. Just imagine this energy coming up into every cell of your body. Just sit with this for a moment. Maybe imagine a color tied to it, or a scent, or a feeling, or a temperature. Take a deep breath in. Now I'd like for you to imagine this energy coming from our ancestors, from Creator, our ancestral wisdom, our ancestral knowledge coming through the top of your head. This Father Sky energy, this ancestral wisdom that gets passed down from generation to generation, coming through your head, awakening all of the neurons in your brain and opening you up to new knowledge and new experiences. Imagine that energy coming down through your neck and your arms, your legs, entering into every cell of your being. Again, imagine maybe a color or a scent or a smell or a temperature to that. Sit with it for a moment and take a deep breath in and release. Now I'd like to invite you to imagine deep inside the core of your being a sacred fire, acknowledging the sacredness of who you are as a human being on this planet. Imagine this energy awakening and moving out, expanding, motivating you, moving you forward. Imagine that energy swirling and sharing and moving with the energy of Mother Earth and Father Sky, expanding out like a bubble, protecting you, guiding you, motivating you, moving you, guiding you. Imagine that energy. Maybe it's just a few inches beyond you. Maybe it's infinite. but imagine that energy, a bubble of energy protecting you and guiding you. Sit with that energy for a moment and take 3 deep breaths. Now I'd like to invite you to come back. Maybe wiggle your toes and your fingers and come back to this reality, this place, this time. And just take a deep breath in and kind of come back. So I like to share that grounding for a couple reasons. One, when we're doing self-care and community care and spiritual care, breath work is one of the most powerful tools that we have in the moment. When we do box breath or breath in the Hawaiian language, the word aloha is actually a sharing of breath. You're inhaling ah, exhaling low, inhaling ah again, and it's the sharing of breath, that sacred sharing. And in Lakota, there's a term called skonskon, and it's the same thing. It's the sharing of breath. And now Western science is starting to understand that when we breathe, when we do box breath, even just for 30 seconds, it helps you to regulate your parasympathetic nervous system. It brings oxygen to your brain. It allows the different parts of your brain to be able to communicate with each other if you're having a trauma response or working with other people. So, this is a tool for self-care that you can utilize throughout your day. And I think it's important to kind of create a practice of that throughout your day. And I'm notorious. I'm gonna be transparent. I'm notoriously bad at self-care. And so I have to like schedule on my calendar throughout the day. Remember to breathe, Danica. Remember to breathe. And so, to just utilize that and a skill to bring it up. And that's like one of the easiest ways that you can do to do some self-care for yourself. So for me, when I really think about how important it is as care providers or people who do this really important work that you're doing, what does that actually mean? And what it means is that we're trying to be a good relative, right? We come into these fields because we have compassion and hope and empathy for people, and we want to be a good relative and help our communities to be better, and to be healthy and happy and all of these things. And in doing that, to be a good relative, you have to be good to yourself first. And part of that, too, for us as care workers is to remember that everyone was meant to have a family and be in community. Like that's an inherent aspect of what it means to be a human being, is that we deserve family and community, and that connection is a strength. Gabor Mate talks about in his book, in the realm of the hungry ghost, as well as in the myth and normal, that trauma, specifically early childhood trauma, creates disconnection. And that's why we seek out things like drugs and alcohol and sex and spending and social media. And that really, like, the antidote to that is connection. But when we're not taking care of ourselves and we're disconnected from ourselves, we're not able to connect as easily with other people. Being a good relative fosters a sense of belonging in the here and the now, and it strengthens our cultural ties and promotes cultural reproduction, right? When we're being a good relative, it helps us to feel understood, and it can increase our ability to be compassionate, caring, and work in this world with kindness. And in this world right now, we need those things more than ever, right? It's easy to get dysregulated and then have your feelings come out sideways. And that's another part of why This is really important for us to do. And so, there's been this movement for the last few years around self-care and really focusing on self-care. But for me, it's not just about self-care. Yes, it's important to take care of yourself, but also part of taking care of ourselves is being in community, and allowing people to also care for us while we also reciprocate and give care. And then one of the parts of Western society that we don't really talk about, nourish and understand is the aspect that we are human beings. And part of that is that we're spiritual beings living in this physical world, and that we need to cultivate and take care of our spiritual care. And I'll talk more about what that means and what that looks like. But that really what is important is that all three of these happen in tandem with each other. They're not compartmentalized. It's not just one thing that you do. And so I want to just, if you can, take a few minutes to think about, what it means to be a good human being. And for me, it's like what it means to be a good human being. When I'm my best human being is when I feel safe and when I feel supported and loved. And so I want you to think about, and, just put it in the chat. What makes you feel safe and loved and supported? Who made you feel this way? And maybe even thinking about those characteristics of that person, in the way that they made you feel the way, and how does this impact the way you navigate the world? For me, my primary, my, experience as a clinician was primarily with adolescents. And, what we know in science, Western science, and we've always known this as Indigenous peoples, that we know that if a child has one caring adult in their life, they're less likely to engage in problematic behavior in the future. And so thinking about what does that, like, one trusted person look like, what and how can that impact you, and what does that look like in your life? And just if you feel open to it, just share that in the chat. But thinking about that throughout this presentation, I think, would be helpful. And if we have time at the end, we can kind of process through. So the why, we are living through extremely difficult times right now. And in reality, we're surviving multiple historical traumatic events at the same time. It's not just one historical traumatic event. We are still in a pandemic. We're dealing with an opioid crisis in our communities. There's political and social and economic uprisings. There's wars happening across the world. There's all kinds of things that are simultaneously happening. And sometimes it can feel incredibly overwhelming. I mean, I regularly feel really overwhelmed at the state of the world. And as compassionate human beings, we can take in all this information and feel overwhelmed by it. And so, as compassionate, empathetic caregivers, we're at risk for vicarious or secondary trauma. And we know that trauma is stored in the brain. And so we need to develop a practice of self and community and spiritual care so that we can, address, this vicarious trauma as it comes along. And we also understand that there's not just one way to address a vicarious trauma, but there are different modalities. And so I just want to offer some of these ideas as just ways that you can consider, and then thinking about, your own family, your own culture. What are the ways in your culture that you've learned how to take care of yourself? And so an important part of that, is understanding that we need to confront the past and, talking about, the history of historical and intergenerational trauma and the current conditions that our communities and that we are currently living in. But my mentor always used to say, don't get stuck in the drama of the trauma, right? Sometimes we get stuck in the drama of the trauma and then we're stuck in the past and we're not really here in the present. And so part of it in getting out of that out of the cycle of drama trauma is to release the pain. And this is really hard. I mean, for me, for a big portion of my life, like my pain was such an important part of my identity that it was like impossible for me to release it. And it took me a long time through therapy and going to ceremony and engaging in healing work to deal with it. And a big part of that for me was, really understanding and addressing the current structures of oppression, and making conscious decisions to move through that. And then, thinking about the future. And, right now it can be really challenging to think about what the future means. But we need to turn our pain and our fear and our frustration into action so that we can benefit our communities, and generate and co-create a future. I think a lot of times we get so stuck in the past and what we need to be doing today that we forget about how we can envision a future that is filled with hope and joy, and really coming back to that original instruction of seventh generations, right, where every decision we make is really like understanding and impacting the next three generations. And so that's an important part of it. So for me, when I really start getting stuck in the drama, the trauma of the world we're living in, and thinking about what a future could look like, and if I can't envision it, what I like to do is lean into like indigenous and African and queer futurisms, which is a form of literature and art and music that also incorporates like our fashion and our, like I'm wearing this really beautiful wampum medallion. This is a form of futurism. It's this like contemporary design with this like very traditional material. But when in futurism, writing futurisms or reading futurisms, which is a form of kind of science fiction, there's always a sense of hope and community and connection that are part of that. So I like to lean to those futurisms to like, help me understand and envision a better future for the next generations. And so really part of it is understanding that vicarious trauma, what it is, and that for us as Native people, especially when we're Native people working in the same communities that we live in and we're from and that we're citizens of, we have, we live and breathe it in our daily lives. And then we come to work and we're living and breathing it. And it's just like these layers and layers of experiences that we have. And that we are more susceptible to vicarious trauma, which is that emotional residue from the exposure of, hearing the stories and seeing the pain that our community members are living with, and we become witness to, the pain and fear and trauma of people who are surviving this, and we have our own experiences with it, and then we have our own experiences with historical trauma. And so our experiences as caregivers in these worlds is very, very complex, and we're more susceptible to vicarious trauma because of it. And so it's important to understand that vicarious trauma is a real thing. It happens in the brain, and with a practice of self, community, and spiritual care, you can really mitigate the impact of that trauma on your community, or on yourself. And so a lot of the work that I kind of came to in developing this presentation came from Audre Lorde. And they have a project called Audre Lorde Project. And if you go to the website, the Audre Lorde Project, they have a lot of information and tools, like assessment tools to assess and use with your clients for assessing self and community care. But really, in the Western world, doing self-care is viewed as self-indulgent, to take care of yourself is self-indulgent. And the reality of it is like our lives are so hard and they're so challenging that caring for yourself is actually an act of political warfare. We have to take care of ourselves so that we can survive and be able to do the work that we need. And so when we think about self-care, a lot of times, especially in popular media, is viewed as like, well, we're just going to take bubble baths and pedicures and, go shopping or, do these things. And it's very kind of commercialized, right? It's all about spending money to do these things. But it's not just that. It can be those things, but really, what it is about connection uh, to your ancestors, to the land, to your culture and community. And sometimes it's not fun. It's about having a practice, it's about going to therapy, it's about really reflecting on yourself and your positionality and your role in this world. And it can mean really addressing some hard, challenging things within yourself so that you can address some of these things. Sometimes it might be that you need to go to the doctor and get on a medication to help you through these challenging times, or, like I said, going to therapy. So, but really for, Indigenous people, for us, it's connecting to these things, our ancestors' land, our culture, and our community, which has its own challenges, right? Because of colonization, we've been separated from our culture. I don't live in my traditional homelands, I live in someone else's, but I still want to develop a relationship with the land that I'm living on and the people whose original land this is. And so, there are sometimes challenges to that, but it's the act of doing those things that can help us, develop our self plan. Living in this world is exhausting, right? I'm exhausted all the time. I'm so tired. And yet I woke up at 5:30 this morning with my eyes just like and couldn't get back to sleep. And so when I'm talking about rest as revolutionary, for me, it's like also going back to the natural rhythms of nature and thinking about the lessons that different seasons have to teach us. Right now we're in late spring coming into summer. We just had our strawberry moon, and we're awakening and there's more sunlight and the flowers are blooming and the bees are coming out and the hummingbirds are coming. There's this like excitement. And but in the winter, we forgot about winter time, where time is a time of dreaming and visioning. It's a time to be in reflection with your ancestors and to sleep and rest. And it's really counter to this kind of oppressive settler colonial structure of the sense of urgency and producing, right? There's always a sense of producing. You should be working, 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 producing, producing, producing. This idea of perfectionism, where rest is really an understanding that it's in contrast to kind of this Western world of understanding things. And so rest is really, really important. And I'm notoriously bad at it. I tend to not take time to rest until my body tells me I need to stop. And so coming back to also, our lessons from our indigenous ways of knowing. These are some lessons from the Seven Grandfathers teachings, which is Anishinaabe. And it says four directions, but there really are seven directions, and really thinking about how we come into balance with all of these. And that's why the spiritual care is an important aspect, because in Western world, we really neglect the spiritual aspect of our being, but kind of coming to, these lessons within your own communities. This is one example of the lessons that we have about rest and self and community and spiritual care, looking to your original instructions about what all of that means. And then this leads into community care. And like I said, self-care is tied to community care. And when we're thinking about, telling people to do self-care, when they're barely holding on, when they need community care, is how we fail people. And for me, I was a drug and alcohol counselor for a long time. And really, when I think about the treatment plans that I created for people, really what it was a self and community care plan, right? So for me, it was like, I was working with kids and I would say, who are you going to call at 3 in the morning when you want to use? That's your community. Who is that person? What is their number? Write their name and number down on a piece of paper. That's like a part of a treatment plan. So identifying for yourself, like, who are your people? Who are you going to call when you really need help? But also, the opposite about that is like, who are you going to call when you have something to celebrate? Who are you going to call when you want to share these successes in your life and celebrate those? So it's not just about reaching out to people when you're in need. It's also reaching out to people when you have things to share. And it's also being available for people. So it's this kind of reciprocal relationship. But it's really, really important that we do that. And then, the other part of it is the spiritual care. And for me, when I define spiritual care, it's really developing a connection with something outside of yourself. And so, spiritual care is for everybody, no matter what their faith, their tradition, what their religious beliefs are. It's a time to be heard and witnessed and to be listened to without judgment. That's why we thank Creator. Thank you for giving us these things. A lot of spiritual care is really about giving gratitude, and being in gratitude. And gratitude is an incredibly powerful medicine for us. When I was kind of, I shared earlier about when I was really stuck in the drama, the trauma. For me, I was carrying so much grief, and it shifted for me because the grief, I had an experience, and the grief transformed to gratitude, and suddenly I wasn't feeling grief. I was feeling gratitude for my ancestors, for my family, for the opportunities that were put forth for me. And that one moment, that shift from grief to gratitude, changed my life. Spiritual care is also a time for exploration. It really helps us to clarify our purpose, our value, who we are, as human beings, our interpersonal relationships. It helps us to provide meaning to our life and helps us to really understand and regulate our emotions. It's not just about religious spiritual aspects. There is a difference between religion and spirituality, and it's not a substitute for mental health care either. Although there's many times overlap. When we think about that medicine wheel, the mental, emotional, spiritual, and physical, it's all in balance. It's not replacing one or the other. So it's not to replace that, but to enhance all of these other things. It's never static. It's always moving and growing and changing. And so it's not just one thing. And my spiritual connectedness changes over my lifetime. Now I'm an elder, and I'm really thinking about my role in this world as an elder, and what does that mean in my spiritual care. And it should be shared within the kind of confidential boundaries of your reporting and mandatory reporting. And so, there's a number of spiritual care tools that we can, and practices that we can think about. And I always kind of think about these as good medicine, right? We want to create our own little medicine bundle, whatever that might be, whatever tool that we have access to, or whatever tool that we have, is to create our own medicine bundle. And what we know now in Western science is that prayer, mindfulness, contemplation, ritual, ceremony, meditation, whatever you want to call it, is really helps us to be more regulated. It helps our brain to become more plastic and less concrete in the way that it functions. Develop creating things in our original instructions. When we create things, whether we're cooking food, we're beading, we're making regalia, we're sewing things, we're making gifts for people. Whenever we create something, you're supposed to put your good thoughts, your prayer, that good medicine into that thing that you create. When you do that, because sometimes our minds can go off into, Albert Ellis used to call it stinking thinking, right? These negative thoughts. But when, we have this practice of like, okay, I'm cooking this food, I want to put good feelings and good medicine into it, it makes your brain more plastic, and helps you to be able to be more resistant to mitigate the impact of stress and trauma. I think it's really important to create a sacred space for yourself, wherever you're at. And so for me, like I have a number of little sacred spaces in my home. I have them outside, of them inside. I have on my desk at home, I have a little, shell with some sweetgrass in there. And that's my little sacred space. So when I'm getting stressed out at work, I don't even need to burn the sweetgrass. I can just smell it. And that medicine kind of helps me to create it. But to have a sacred space, a place that you can go and just be silent and quiet and just get your nervous system regulated is important. And when I think about the work that we do in whatever capacity, whether it's public health or counseling or whatever it is, what we do is sacred storytelling and sacred listening, sacred story listening. We're hearing people's sacred stories, but it's also important to share your stories. And the important part of that is creating a safe space and finding safe spaces or safer spaces to share your story and to have people listen to your story. And those are, some of the tools that we can have. And when we think about community and spiritual care in Indian country, ceremony is part of that. Whatever your cultural ceremonies are, to try and participate in your cultural ceremonies. Talking circles are part of this. Being part of kind of mutual aid or indigenous economies where we're sharing and bartering versus utilizing money. Being involved in justice movements can be part of this, whether it be, I always think, in California, you guys, some of the northern tribes like fought for so long to get those 4 dams taken off the Klamath and Trinity rivers. And now the first time in 100 years, the first salmon has come up that river. And just even thinking about that, it just makes my heart like so full that, that those people like did that work and are caretaking for our 7 generations and for our, those salmon relatives. Being involved in cultural gathering and events and being in communication and community is an important part. And, a lot of it is like when we're working in this communities and living in this communities, it can feel exhausting, to work all day and then have to go to a community event. But it is important to be part of those communities and be available and seen. Again, intergenerational connection and practice. We hold our elders in such high esteem, but also remembering that our children, that those relatives they have a lot of knowledge too, and they offer us a lot of lessons, right? They teach us about being questioning, being excited, learning, growing, all of those things. So developing those kind of intentionally developing intergenerational connection and practice. We did some focus groups a couple years ago where we interviewed elders about cultural knowledge, and we interviewed youth about that. And elders were saying, well, we really want to teach the young people, but they don't want to come. And the young people were saying, we really want to learn, but we don't know how to do it with respect, and so there's this disconnect. So just reaching out to the different generations to share, sharing food, being involved in wild variety movements, all of these things are part of our community and spiritual care. And I love this kind of these lessons from Dr. Dolores Bigfoot, and she reminds us that we're sacred, that we're honored, and that we were prayed for, that we are the prayers, we're the manifestation of prayers from 1,000 generations. And to me, that's like one of the most, when I get really down, like that's what I remember. And I just remember like my ancestors sacrificed so much for me to be here, that I have a responsibility to, to be good and be a good relative, that we're not alone, because of that our ancestors are with us, that you were known, before you even came, before you were a twinkle in your daddy's eye, you were known and prayed for, and that you have a lot of choices, and that you have a name, and our names are important to who we are, um, and that it's important to know your name and know what your name means, and who, what that means for you, and that we reach out to others and be good relatives. And so that's the end of. I added some other resources in here, and the coordinators can send out the PowerPoint for all of you to access that. But that's my presentation. I just want to open it up for some conversation or thoughts. If there was anything that resonated, anything I missed, I'm also open to criticism and feedback. So thank you. And thank you for being good relatives. I'm just so grateful.
Thank you, Danica. All right, the floor is open. So